Welcome to the Advancing Health Literacy Podcast, where we give you tips on how to stay healthy, whether it's your physical health or mental health. We provide community events like hiking engagements and workout sessions. We take pride in making sure you are staying active. We cannot forget about our refreshing podcast, providing you information on many health-related topics like opioid abuse, heart health, COVID-19 updates, and many more. And up next, we are taking a deeper dive into mental health. Stay tuned for more. But that wraps it up. So far, we had an eventful few months, and we can't wait to see what the future holds. Don't forget to like and subscribe to our YouTube channel so you can stay connected with us.
Hey everybody, how y'all feeling? You guys feeling okay? We good. Feeling good? Yeah. I love to hear. Well, my name is Elijah Brantley. You just saw me up on the screen. That was me. That was me, my sister, guys. But yeah, we're with InnerCity Collaborative, CDC, with their Advancing Health Literacy Initiative. We're super excited to be here today. We're going to talk a little bit about what we've been doing so far and what our future holds and everything like that. So, super excited.
So, what we're going to be doing today is who we are as an AAHL team, and our goal and mission, our framework and logistics, our challenges, lessons that we learned, and then we have a small video presentation at the end as well. So meet the team. Who are we?
Well, I'm Judy. Hi, Judy. I am their fearless leader and the program administrator for our Advancing Health Literacy Initiative. And it has probably been, as I was just sharing with my Department of Health colleague here, it has been a passion and a calling of mine to be in this ministry, because that's what I look at it as being, is just another service that we provide.
And I am Camry Johnson. I am the Wellness Co-Administrator for this initiative. I also help to navigate our youth ambassadors when it comes to viewership, what we need, what we should talk about, so on and so forth.
Hey guys, I'm Elijah, once again. One of the Youth Wellness Ambassadors, also one of the hosts for our podcast that we have. You saw it up on the screen, kind of talked about that a little bit. And just a general content creator. Reverend Judy had a vision to have people who look like our audience that we're trying to reach, and so she reached out to us. And so having two young people at the forefront of this is very important, so we don't take this lightly at all, so we're super excited.
Hello everyone, I'm Amari. I'm the other Youth Wellness Ambassador for ICC CDC, also the co-host for the podcast. And I'm excited to see everyone. Hope you guys are ready for everything we have.
Greetings and salutations. My name is Christopher Harris. I am the digital and media communications person, so anything content, anything recording, graphic design, that's all me.
And we couldn't do any of this without
And I would agree with that one. So, our goal and mission, what do we want to accomplish? Excellent. For the InnerCity Collaborative CDC, Advancing Health Literacy Program is driven by a single goal. We try to reach out to navigate our energy more towards the Black and Brown community, the underserved, but especially our youth, as we have said multiple times. But we just want to emphasize that because it's very important that we are making sure that we are encouraging our youth that health is important. Like, you don't want to wait till you get older to worry about your health. Like, sometimes with the smoking, drinking, like, we just want to party, we just want to do this. Sometimes you just have to sit down. Sometimes you have to reevaluate yourself and notice that things do start happening and reoccurring as you're younger. It starts from the beginning. So that's the thing. And then AHL ICC is a local funded initiative of DC Department of Health, and is focused on promoting health literacy, improving healthcare experiences, and promoting COVID-19 safe regards. We launched our program in January of 2022 in the District of Columbia with a mission to empower, consult, collaborate, inform the community by providing fact-based information, promote health awareness, and also offer collaborative education outreach to increase access and exposure to health-related topics and patient-provider relationships. Next slide.
Yep, so I'm back again. I'll just talk a little bit about our framework and logistics, kind of just talk about what we're doing and how we're doing it and what our mindset is in going into the things that we're doing. All right, so first I want to think about, if you take a look at all the different points here on the board, you can see that community is involved in each and every one of them, because community is the most important thing. I like to think of community as a well-oiled machine, and there are a lot of things that make it work and that make it function. So the first point being empower. We want to empower and uplift our community. That is our main goal. We want to make the community excited about learning about health literacy and knowing what's going on within their bodies, knowing the dangers of drug abuse, alcohol abuse, and the different things of that sort. So it's super important to make sure that the community is involved and that they're excited. It's easy to just talk to people, but if they don't understand and if they're not excited about it as well, you're not getting to your audience. So we want to make sure that they're excited about it as well. So that's why we want to empower them. So that's just the community as a whole. To inform, that's more specific. We want to inform a specific audience. We like we talked about earlier. Reverend Judy had a vision to have the youth talk to the youth because it's important to talk to the community, being a part of that community as well. So being a part of that community, we my sister found it very important to speak to people our ages, a little bit older than us, a little bit younger than us, because there's so many different areas that we need to reach. So be teachers. So we want to go to people and we want to give them information that we've learned because we were also students at a time. So then we want to become teachers to others. So we want to make sure to keep informing those communities and things of the sort. So consult. So this is where you guys come in. We want to reach out to our communities. We want to hear from you all. We want to hear what you guys think of the content that we've put out so far. On our Facebook, our YouTube posts, our Instagram posts, you guys comment saying what you want to see next, what you enjoyed in this video, what we might can fix. We also want to be teachable as well, so that way, like I was talking about, we teach others. We want to be teachable from you all to hear what you all want to see. If you don't like a video, comment, I didn't like this video.
That really helps.
It's okay. And we'll see it. We'll be like, what? And then we'll want to know, why didn't you like the video? So when you put, I didn't like this video, put, I didn't like this video because, comma, and then let us know why you didn't like said video. So that way in the next video, we know how to fix it because we want to be teachable as well. And we also want to consult with each other. This is a team, we're a team. As you can see, we're a big pack. So when we come together. So whenever we do something, we want to make sure that we're consulting each other. What do we want to do? Who do we want to collaborate with? What do we want to do next? And that goes into my next point, which is collaboration. In the video that you saw earlier, you kind of saw some of the people that we collaborated with in the past. We want to continue to do that, collaborate with people within our community that have an impact. Because while we have an impact, there are people who have a bigger impact than we do. Mm-hmm. So we want to make sure that we're collaborating with them so that we can grow together. Because that's our main goal, is to grow. So that's kind of what we've been doing so far. I hope you guys enjoyed what you saw so far in the video. Hopefully we can show you guys some more once you guys subscribe to the YouTube.
Right.
You guys can watch the YouTube. We have some videos coming out soon, so hopefully you guys can watch that and see what we're really doing in the community. Because we really want to make an impact. So we hope to have you guys help with that as well. So thank you.
All right, so on to our challenges. How many people think doing good is easy? Okay, so this is where we're going to get into some of the challenges we face trying to do better in our community. Okay, starting with number one, increasing podcast viewership and subscriptions. So we have a social media where we try to, outreach with our community, but it's not always easy reaching the audience because people may view it, but they may keep scrolling, keep swiping. Like you ever see something like, oh, that's cute, that's funny, swipe, but they don't really interact with, what we're trying to do. So keeping them engaged, like you said, engaged and excited about what we're doing. Also creating partnerships. So we are a faith-based organization. So people that align with what our mission and our statement is, it's sometimes hard to find people that, can co-work with what we're doing. You understand what I'm saying? Also finding ways to make our podcast appealing. So like he said, keeping them engaged, excited, because health is not really one of those topics where it's like, oh, we're talking about health? Yeah, what are we talking about? It's just like, okay, yeah. Healthy, yes. Like, but we want to make sure that we're actually being healthy, not just talking about it. So it starts with us, so we can't really relay a message that we're not taking part with first. So, yeah. Also, understanding the racial and ethnic health disparities. That's very important in our community because, one, we are a smaller community where some resources don't reach us as much as they may reach another community. So making sure that we have full resources and make sure that we're sharing them with people that we know so they can keep sharing and keep relaying the message. Also, COVID-19, that was a time. COVID-19 kind of helped us in many different ways and also hurt us in a lot of ways. We were isolated, everybody in their corners, but being healthy and staying consistent and being sustained in COVID with health facts and different stuff like that was a little bit of a challenge, but we also came out of it with a lot more strength as well. So we had all learned some new stuff, we all had to cope with some new stuff, and mental health was definitely tried in COVID, but being able to come out of it with a lot more knowledge about yourself, knowledge about people, knowledge about health was also something that was a challenge, but it also helped us. So.
All right, so even though we had some challenges, we definitely learned from them as well. One major thing that we learned is that consistency is key.
Yeah.
Like when it comes to posting, making sure you're active on the page, also building connections, like consistently checking up on the people that we connect with, that we network with. Also making sure that we're communicating effectively, especially when we're talking to the youth. Because a lot of youth don't know the big terms that we use within the health field. So we kind of got to break it down a little bit, make sure we explain it to as much as we can. And also being innovative and creative, because like you said, we have to engage them. We have to make sure that they're excited about it. They want to listen to it. They want to read it, and many more.
Okay. Personal health literacy refers to the degree to which individuals have the ability to find, understand, and use information and services to inform health-related decisions and actions for themselves and others. Thank you.
Thank you.